Hi there, it's Dr. Jim Collins. Thank you for spending some time with me. I have a great topic because a lot of people take these things. These are the most commonly prescribed psychiatric medications out there. It seems like everybody is taking something. So these medications are generally prescribed by psychiatrists, physicians, family doctors, so on and so forth. And they're meant to manage symptoms that are associated with mood, behavior, and thoughts, right? So some are, though, prescribed for very serious mental conditions like schizophrenia and bipolar disorder. Um, they're usually prescribed in combination with therapy, although not all the time because not everyone likes to or is willing to go into therapy. But I've always learned that that is the ideal model, medications and therapy at the same time. So 47 million Americans have reported that they have issues, mental issues or emotional issues at some time during their life. And another 11 million Americans report that they have very serious mental conditions at some point out of their lives. So if you take those millions of Americans and simplify it, one out of every five Americans, 20% of our nation, will experience some type, form, or degree of emotional or mental distress or issue. Okay? Now, the commonly prescribed medications out there include antidepressants, anxiolytics, which are anti-anxiety medications. Then you have the psychostimulants, which are for diagnoses like ADHD. You have mood stabilizers and antipsychotics. Those are the big types of psychiatric medications, most common types. And they all work generally by interacting with neurotransmitters, which are brain chemicals. For instance, selective serotonin reuptake inhibitors, SSRIs. Um, these medications are molecules essentially, and they are binding with serotonin, and they're allowing the serotonin to do what it normally would do, but serotonin needs just a little bit of help. And the effects are decreased depression and enhanced mood. And then the anti-anxiety drugs work on the neurotransmitter GABA, and GABA is responsible for keeping our brain nice and balanced. The brain doesn't overreact, and it remains rather calm. So when we take an anti-anxiety medication like Xanax, again, it's a group of molecules interacting with neurotransmitters in our brain and throughout our body and producing the calmness associated with it. So you must know that all medications come with side effects. Some are serious, some are troublesome, most go away after 2 weeks. Despite that, if you are dealing with some pretty heavy side effects, I would go to your health care provider and talk about them, identify them, don't ignore them, and you should take them rather seriously. So, and they need to be monitored, side effects need to be monitored regularly. So, in sum, millions of Americans do struggle, millions of Americans will struggle with emotional and mental issues. Thankfully, we have so many tools that can help, including medications, psychiatric medications, including therapy or counseling, and something I'm a very big fan of, self-help. I think we could help ourselves sometimes more than professionals can help us. And so, but be patient, because finding the right medication at the right dose is what really makes the difference. And you'll get the best benefits by the right med, the right dose. So be patient. Your time will well be worth the effort in finding the right med and the right dose. So I'm Dr. Jim. That's what I have to say about commonly prescribed psychiatric medications. I hope you come back for more information. Thank you. GoPro, stop recording.